Thank you for choosing Axxess On Demand. Axxess believes in continuing education, and we create content to empower you to learn and grow anytime, anywhere. Let's get started.
Good morning, everyone. Thank you so much for joining us for this live webinar where we will share best practices to ensure clinical quality and operational excellence to help you deliver successful outcomes for your home care organization. My name is Laura Barnett, and I'm the Senior Director of Product Marketing for Axxess. Before we get started, I'd like to tell you a little bit about Axxess. We're a leading home healthcare technology company offering a complete suite of easy-to-use, innovative software solutions, empowering home care, home health, and hospice providers to grow their business while making lives better. Today, you're going to hear from our home care clinical product manager, Lisa Malone. Lisa has more than a decade of experience as a clinical director for a nationwide home care agency, specializing in medical services, non-medical services, as well as pediatric private duty nursing. Joining Lisa today is Brian Nelson. Brian is a product manager at Axxess. He provides leadership for the Axxess home care team by working with both clients as well as engineers to ensure the operational success of the solution. Prior to working with Axxess, he served as the regional field operations manager at Maxim Healthcare Services, where he successfully led several software implementations throughout his region. Before we get started, a couple of housekeeping items as well. Everyone is on mute. However, feel free to submit questions throughout the webinar in the chat box on the right. If time permits, we'll answer as many of those as possible at the end of the webinar. If we don't have time to answer your particular question, we will absolutely follow up with you after the webinar. So following the webinar today, we will provide everyone with a link to the slides, and we'll also post a video recording of the webinar on our website at axxess.com. I know you guys have a lot to get to today, so Lisa and Brian, take it away.
Great. Thank you so much, Laura. Hi, everyone. We are going to talk about clinical quality, operational excellence, and some keys to success. So for clinical quality, we're going to go over client care, fulfilling care needs, and compliance as kind of our three main areas of focus for clinical quality. For operational excellence, we'll talk about sourcing caregivers, financial viability, and efficiency as our three main points. And then we're going to talk about some keys to success, which include trust, communication, and a shared vision.
Lisa and I have spent a lot of time together preparing for this webinar and talking through, what we thought made sense from a clinical and operational perspective that would lead to success. So the first idea that we talked about is, is this kind of a balancing act? So you have clinical quality on one side, you have operational success on the other. And throughout the course of a day or a week or the life of the agency, these two kind of different things are working to balance each other out, and that balance would lead to agency success. But we decided, no, that's not maybe the best analogy or metaphor to use.
Right. So then we thought, well, maybe agency success is more of a seesaw. Or a push-pull, where operational excellence is pushing one direction and clinical quality maybe is pulling the opposite direction. And we want for the operational excellence and the clinical quality to push and pull in about the same amounts so that it evens out. And then we decided that that wasn't exactly it either. So then we thought, well, maybe agency success is more like an equation that adds up to success. So some equations obviously are a lot more complex than others, but this one's pretty simple. Clinical quality plus operational excellence equals an agency success, which sounds pretty simple, but then we thought, well, no, there's a little more to it than that.
So finally, we decided on, kind of using a lens or a glasses analogy of, clinical quality and operational excellence are a separate focus, but at the end of the day, you have a shared vision. So I think that's a really good picture of how these things work. One can't, both can exist without each other, but in order to be truly successful, they have to be put together and married together, if you will. So we're going to spend a lot of time today talking through how each of those, clinical quality focuses and operational excellence focuses work together to create a shared vision for the agency and lead to that agency's success.
First, we're going to talk about clinical focus number 1, which is client care. So if you're in home care or the healthcare field in general, it's because you're passionate about providing quality client care and taking care of people. And for most, this is clinicians and caregivers, it's their number 1 focus as well. So how exactly is this achieved? Well, it all starts with clinicians and caregivers that you hire, which brings up the question, should I hire experienced caregivers or caregivers that maybe have a little less experience, but I see a lot of potential in? And I would say that the answer is yes, yes and yes. Experienced caregivers, obviously can bring a wealth of knowledge to your agency, but also they can bring innovative ways to handle different situations. From my experience, experienced caregivers, caregivers who've been doing this for a long time and have been in many homes, dealing with many situations. For whatever situation pops up, they probably have been through it before, and they either did something that worked well, or they did something that didn't work out well, so they changed course and did it differently and have kind of figured out and learned new ways to get the job done. I would say that experience also comes with the potential for resistance to change, though, and I think most of us have probably seen instances of that in the past or in our past experiences. So as far as hiring caregivers with maybe a little less experience or a lot less experience, but when we see potential, that can be a great option as well. Maybe a caregiver has experience in one area, but has less experience or maybe no experience in the area that you're looking for. So asking the right questions to see how they've handled other situations in the past can help you kind of extrapolate the potential to learn new skills needed to provide the quality care that you're looking for. Look for people who ask questions, who offer new ideas. Also, caregivers who might be a little less experienced but have great potential, you'll also see some new innovative ideas come from someone who hasn't done the same thing the same way for many years. So ultimately, you can get some great innovative ideas from both experienced and inexperienced, but you see potential in caregivers. And then secondly, you'll need to set some quality standards. You'll have to decide on what quality standards you want to use. And some of these could include patient safety measures. Maybe you want to measure the percentage of patients needing emergent care for a wound infection or a deteriorating wound status. You might want to set a quality standard for effectiveness measures, like measuring the percentage of patients showing improvement in a specific area. For example, maybe ambulation or bathing or management of oral medications. You could set a quality standard on patient-centeredness measures, something like percentage of patients who report that their home care provider treated them as gently as possible, or the percentage of patients who reported that their home care provider or their caregiver talked with them about their pain level or their medications, or explained everything that was going to happen, or provided them education that they could understand and learn from. And then you could always a set a quality standard of efficiency measures, like measuring the percentage of patients admitted or readmitted to a hospital, to an acute care kind of setting from your home care agency. So those are some of the ideas for quality standards that you might want to set.
Yeah, and then the operational kind of aspect of that is being able to source caregivers. So in my time in agency operations, that was what I kind of lived and died with, was how many caregivers do we have? How many caregivers do we need? How do we eliminate missed visits? And how do we take really good care of our clients? So whenever you're looking at sourcing caregivers, there's always this kind of constant battle between, is recruitment a quantity game or a quality game? And so for many of my years working in operations, it was a quantity game. We were just recruiting everybody on earth that we could, calling anyone that we could, having all kinds of people come in for an interview. And then, from that, if we had 50 people come in, maybe we hired 5. So we were just trying to get as much volume as we could. The issue with that is, one, that takes a lot of time. So your schedulers, your recruiters, your clinicians in the office, if they're a part of the interview process, they're all getting bogged down with these maybe less than quality caregivers, but you're volume based, so that's just kind of your process. So what we kind of shifted towards in some of my offices was really focusing a much more targeted approach on, which of these candidates are truly quality, which of these candidates, are going to show up, are going to be folks that we can count on. And instead of bringing in 50 people that are okay, let's focus in on those 5 or 10 that we think can be really good, devote time and attention to following up with them, sending them emails, setting, firm appointments, reminding them of the appointment to make sure that they do show up. And, more often than not, those would be much more quality interactions that we have with those caregivers, and the caregivers themselves would be much better. And that can kind of have a trickle down effect of, they're more likely to refer higher quality caregivers that they're friends with. You're going to have less late arrivals, and ultimately you're going to have better client care. The other thing that's kind of a constant conversation whenever you're recruiting folks is looking at performance versus personality. So we have to kind of look at, these folks are going to be out in the client's home for 8, 10, 12-hour shifts. And even in some scenarios, they're going to be, living with the client or staying there overnight. So having a winning personality, or having a personality that connects with the client and the client's family, is really important. But if they're a poor performer, they don't document well, they don't provide care well, they don't maybe show up timely, it kind of doesn't matter how great that personality is if the performance isn't there. And then the reverse of that can be true too, right? So you can have someone who shows up on time, does everything that they're supposed to, but maybe doesn't have a personality that matches with the client, or maybe doesn't share common interests, or there's some conflicts there. So being able to kind of balance those two things is really important. Knowing your client and know what they respond to also is really important, but balancing that quantity versus quality and performance versus personality is really important whenever you're sourcing your caregivers.
All right, so our shared vision, number 1, kind of matches up for clinical, the client care, for operations, sourcing the caregivers that will provide that excellent client care. And for the agency, that means satisfied clients and caregivers. So for our clinical focus number 2, we'll talk about fulfilling care needs. Basically, this is missed shifts, right? We want the least number of missed shifts as possible. The care needs will be decided by several ways. That could be a physician order, a payer authorization, that could be client or family request, your agency's assessment, And most likely it's a combination of all or several of those together. So first we'll want to decide what exactly is essential. Essential for client safety as well as client goals. This will need to be done really on a case-by-case basis, looking through all of the clients and their needs to assess what exactly is essential so that you can figure out who needs what and almost prioritize some of those needs. Let's say someone who was just discharged from a hospital, they might have some care needs that are more of a priority or more essential than a stable client with family members who are available and willing to provide that care. So once you've assessed what exactly is essential, then you could move on to solving the personnel puzzle. And this is where your clinical focus can really assist the operational team in figuring out what caregivers have what needed skills for what clients who have those requirements. And then how those caregivers can be moved around the puzzle so that you can attempt to cover every need or as many needs as possible. So an example of this might be a caregiver has experience in using a Hoyer lift in the home. And that caregiver has been working with Betty, who needed a Hoyer lift, but Betty actually has improved enough to no longer need the Hoyer lift. So she can get up using a walker now with just some assistance. But let's say you get a new client who has a Hoyer lift. So your caregiver that was at Betty's house, but Betty really no longer needs the Hoyer lift, but that caregiver has experience with the Hoyer lift, you may need to move that caregiver, if you don't have anyone else with that has availability with Hoyer lift skills, you might need to move that caregiver to the new client. And then another caregiver who has skills with assisting someone with a walker, but not the Hoyer lift, can work at Betty's house. I know that's kind of a simple example, but this can get a little more complex when you're talking about maybe ventilator skills and someone who, a caregiver who has ventilator skills, but their client is no longer on a ventilator. You might have to move that caregiver to a new case that, let's say, just got out of the hospital and has a ventilator. So these are some of those, puzzle pieces moving around, obviously having some conversations with clients as well. But this is what I call the Tetris game, figuring out which pieces fit where.
Yeah, like I said, and it truly is a Tetris game, and I think that was, a large part of my life was having those group conversations, having, whiteboards and pens and papers and Excel spreadsheets out and looking at all of these different, combinations of caregivers and clients and just trying to figure out a way to get everybody covered as safely as we could. For our operational focus number 2, we're going to look at kind of financial viability as the overall focus. And so the first aspect of that is prioritizing profitability. Anytime you talk about profitability with, home care or home health in general, that's always kind of a quick, eek moment for people, right? We definitely need to focus on caring for the clients and taking care of them. So, pulling money into that equation sometimes kind of turns people off or it can be an uncomfortable conversation. So let me just preface this: whenever I say prioritizing profitability, it's really looking at being able to analyze what business that you're doing is profitable and objectively evaluate, your client's needs. So it's not prioritizing it over client care. But whenever you're looking at profitability in general, the most obvious thing to look at is those direct costs. So, what's the cost of doing business? What's your overhead in your office? How much is your, rent for your office space? How much do your internal employees cost? Those kinds of things. Another common one that we look at is overtime. So really analyzing, if you have a client who's authorized for, 60 hours a week, but they're only going to allow one caregiver out there. So you're doing 40 hours of regular time and 20 hours of overtime. Is it really a financially viable case with that with that setup, and can you talk with a client about adding in another caregiver to kind of eliminate some of those overtime costs? The other thing that we have to do from time to time is, again, while you're analyzing the profitability is, maybe renegotiate rates. So if that's a private pay client, spending some time and talking with them, maybe it's a client you've had on staff for 3 years and need to kind of talk through, hey, the economy's changed and we've increased costs and, we need to raise your rate slightly. Sometimes that's building in an escalator into the initial contract. So, hey, for every, 6 months or a year that you're on services with us, the rate will go up, 5% or 6% or something like that to kind of keep up with inflation. And then it could be something like negotiating with an insurance company or a company that if you're working with Medicaid waiver programs, going to the state and trying to renegotiate rates with them, which is a long process and often takes several years worth of work and lobbyists potentially and kind of coordinating with maybe other agencies in your area or in your state. The next thing to kind of work through is indirect costs. So those are things like maybe a client who has unattainable expectations. So you've got this client on service and they expect for 0 missed visits, and that if you have a missed visit that, one of your schedulers would come out and fill in, and, there's just no room for any kind of flexibility with them at all. So some of that might be trying to reset those expectations, but if you're constantly failing to meet those expectations, having a conversation with the team about, does the profitability of that case make sense with, the inability to reach the expectations. And some of it might be emotional considerations. So in home care, there's always going to be challenging situations and challenging clients. So, there can be certain clients that are an absolute just emotional drain on the office, and you end up spending a ton of your time trying to please them, trying to make them happy. And that's, you're sacrificing care that, customer service that you could be providing to some of your other clients who maybe are a little less vocal. Another one is potential liability. And this is, something to definitely analyze for all of your clients, but especially before you've even maybe admitted that client is, take a look at the home, take a look at the family situation, and really evaluate, are there any red flags there? Are there any potential liability issues that you can foresee down the road, and kind of adjust your plan accordingly? And all of those kind of equate into opportunity cost, right? So just taking on some of this bad business and maybe taking on some of these more difficult clients, again, leads you down this path where you're going to be spending 80% of your time on 20% of your clients, and that can have long-term lasting negative impacts to your current staff or your current roster. And so our shared vision for these two items, so clinical is focused on fulfilling care needs, operations is focused on financial viability, and then your agency shared vision from that is going to be healthy clients and healthy profits. So one of the mantras that I kind of had in my offices was always that you can't be in business without taking care of your clients, and you can't take care of your clients if you aren't in business. So it's a constant, again, kind of push-pull on balancing those two aspects, but overall, it should lead to healthy clients and profits.
And then our clinical focus number 3 is compliance. We all know how important compliance is, and in home care, compliance can really range from Medicare type compliance from CMS, conditions of participation, all the way down to some home care agencies that are less regulated or even unregulated. But compliance still is important, that caregivers and your agency staff are following your own policies and are compliant with those. So compliance is very important to the agency, and I would say compliance really makes or breaks an agency. So an important thing to do is to really create a compliance culture. And this starts with, I'd say, the interview, even before a caregiver is on staff. Really talking about the importance of compliance, the importance of reporting compliance issues, the importance of following up on those issues, creating a plan, and then of course the communication is really important for all of that. Have discussions about compliance issues openly with internal staff. Everyone at your agency, at your organization, needs to know about compliance, needs to know that you want a culture of compliance. Not just your caregivers, but even your internal staff right in the office. Everyone needs to be aware of the importance of compliance, and they need to be bought into that importance. And that's where really creating this culture of compliance comes in. When everyone knows what compliance is, the importance of compliance, and has open communication about it, and knows that there's an expectation of compliance. Caregivers should have compliance elements in their maybe annual testing or annual checkoff, or as part of their performance evaluation. And then for internal staff meetings should have some sort of compliance element, even if that's just reviewing a policy or a regulation pretty regularly, to educate staff and remind people about compliance and remind people what the policies are and what the regulations are that you might be needing to follow. This is an important part of the staff meeting and of creating that culture of compliance. I remember we would do this at the agency that I was the administrator and director of nursing for, and we would talk about new compliance regulations, of course, that came out, but we had a little compliance section of our staff meeting. So in a staff meeting, I was going over some new regulations that the state had put out that we needed to start following, and those were the regulations went into effect the following week. So I was re-educating the staff about, remember, this is what we have to do now. And one of the account managers kind of chuckled and said, right in the middle of the staff meeting, ha ha ha, nobody really cares about compliance. And so that is what we, outside of that meeting, had a conversation about that. Because even in joking, that does not set up a culture of compliance. You really want everyone at your agency to know that compliance is important, and it's really not a joking matter. We can joke about a lot of things, but compliance is probably not one of those, because it will slip. It will start to slip when you're not focused on it. So you're going to have compliance issues come up. Of course, you're going to. It's just going to happen. These are going to come up after hours and on weekends, but deadlines for reporting those don't change when it's after hours or on a weekend. So if you've got 24 hours to report something that happens on a Friday night, your on-call staff needs to know what to do. They need to know, that when something gets called in and reported to them, that it actually is a compliance issue. And then also what to do about that, who to contact, so that those issues get reported timely, and you don't get fines maybe from an oversight agency. So on-call staff needs to be informed about it. Schedulers in the office or an administrative assistant that may get the initial call when a caregiver calls in or a family member calls in and brings something up that is actually a compliance issue. If those folks answering the phone and hearing that initial call don't realize that it's a compliance issue, you as the administrator or the manager might not hear about that issue for a few days or potentially longer. You know, once you're doing a chart review maybe, and then you're noticing some documentation and realize maybe weeks later that something happened. All of a sudden, if that was something you needed to report, you'd be out of compliance. Also, just for patient safety and patient quality care, you want to follow up on compliance issues as soon as possible so that you can put your plan in place that those type of issues don't happen again. So all of your staff needs to know the importance of compliance issues, the requirements for reporting the issues, and then that it needs to be addressed, that a plan needs to be put in place so that the issue doesn't happen again, and hopefully prevent any future issues similar to that happening again. And then I've got trust but verify here. I think probably most of us would agree, if you've managed or been an administrator for a home care agency, absolutely you want to trust that your staff is, once they've been educated, that they are reporting incidents, they are following up on compliance issues or even potential compliance issues. Maybe you can head those off before it actually becomes a compliance issue. But you definitely need to go ahead and verify that as well. Trust but verify is always a good motto.
Thanks, Lisa. That's a lesson I fortunately or unfortunately, I guess, learned early on in my career. One of the activities that we did from a compliance perspective was to daily check our fridge temperature. So we used to store vaccines in a fridge in the office, and we had these logs that we would have to fill out. And so I had delegated that to one of my employees, and we had set up this great system where we had this great binder and had calendar invites set up, one in the AM, one in the PM, to make sure that I got checked. And 3 months went by, and I was really proud of myself for setting up all this great stuff. And an auditor came in, and of course that was like the third thing that they looked at was our temp log, and turns out that employee had not done that for the last, 2+ months. And obviously after the auditor left, we had a heart-to-heart about what had happened there, and his reply was, well, you stopped asking me about it, so I thought it didn't matter anymore. So anyways, learn to trust and to verify. So which kind of leads me into the operation focus number 3 regarding efficiency. So one of the ways that I kind of evaluate efficiency is around people versus processes. So in order to scale, in order to grow, you really have to have great people in your office, and people help things operate smoothly. But people go on PTO, people might get promoted or get a different role within the office, or may even leave the agency. So you really have to balance having great people and having great processes. So having great people is good until you start growing or until things change, and then they may not have the same capacity that they did as your office grows. So having those great people establish processes is really what's going to lead to long-term sustained success. It also kind of helps create a system of checks and balances where hey, this is the process, this is how things have to be done. And so anytime there's an issue, it's much easier to have a root cause analysis done whenever there is a process. So you can see, hey, did we have a process breakdown and maybe we need to revamp the process? Or did we have a people breakdown and we need to address that in another way? Processes also can help kind of mitigate issues with maybe some lower performing folks in the office, and that you have a very set structure that they could follow, that they don't need a ton of guidance on. Having a checklist or something like that can really help out. And then the other item is making sure that you're 100% compliant. And the alternative to that is sometimes people can be 110% compliant. So the agency that I used to work for, we for a very long time have been very focused on driving profitability and driving growth, and that led to some compliance issues. So we reevaluated things and and kind of went the complete opposite direction and said, we're not going to be focused on profitability. We're going to be solely focused on compliance, which needed to happen and led to some great changes and updated some policies, which was a win. The kind of pitfall to that was we stopped growing and we stopped trying to improve, the operational profitability side of things, and we're only focused on compliance. And then because we were only focused on compliance, we began doing things, well above and beyond the policies and procedures of the state or the nation. So a great example of that is for the type of business that we did. For our clients that required nurses, we had to do a supervisory visit every 30 days. And for our clients that required a CNA, we only had to do one of those supervisory visits every 60 days. But in this big push to kind of max out on our compliance, we decided that all clients, regardless of service, needed to be seen by an RN every 30 days. So needless to say, this put a ton of burden on the internal RNs to go out and essentially supervise some of these clients twice as much as what they had done before, and just kind of created an added cost. You're paying for mileage, you're paying for your folks' time, and again, that opportunity cost of time that the RNs were spending out of the office was time that they weren't able to maybe interview or do some of those things. So kind of trying to be 110% compliant actually caused more issues than it solved in that scenario. And so our shared vision for this is, clinical being very focused on compliance, operations being focused on efficiency, and then your shared vision is scalable processes and procedures. And so those are kind of our, again, those shared purposes and visions. And so now we kind of want to talk through our keys to success here. And me and Lisa will do our best to not sound like marriage counselors here, but you're going to see some common themes of trust, communication, and a shared vision. So the first one is trust. So starting or potentially restarting, that relationship between clinical and operations with an expectation of trust. There's countless books written about how trust is the foundation of all relationships, whether that's, marriage or business or what have you. And it's really easy to say that. It's much harder to actually implement that, right? And finding some common ground where you can build that on trust is a challenge. And that kind of gets us into our second point, which is, really creating relationship building opportunities. That's doing things outside of work where you're able to see your coworkers in a different light, and ideally maybe not talking about anything related to work.
Right. I know that when I was the director of nursing, I had an operational partner, and that was the director of operations. And we decided to really get to know each other better so that, it's easier. You can definitely say, let's start with an expectation of trust. I'm going to trust you until you do something that decreases my trust level. So that's easy to say, and we can do that, but y'all know that it's easier to have trust when you know someone, when you have a bit more of a relationship with them. So my partner and I decided that one day a week we were going to go to lunch together. And we did that for several years. Once a week, we went to lunch, and we would really try to not talk about anything about the office. And we would just get to know each other a little bit and see how things were going on in each other's lives. Another thing that we did, and granted right now that might be a little more challenging for everyone, but doing some things like this to just get to know each other outside of the office, but besides what their role in the office is helpful. We had done things like go to an escape room. All the managers of the office, the leadership team, went to an escape room together, and we, again, that might be a little more challenging now, but hopefully in the not so distant future, we'll be able to do some things like that again. But we really learned a lot at a silly thing like an escape room. We learned a lot about ourselves by the end of it, and how we strategize and how we make decisions and how our brains think differently. And then we had a little talk about that afterwards, and how we each saw different things in each other and ourselves, and how those could all marry up together to really create a great team and have strong relationships. And that was just getting to know each other and kind of doing some fun things together, not really work related. Next up is communication. So setting a structured rhythm of communication is important, as well as constant communication. So this could be setting up something pretty structured, like operational and clinical partners are going to have a quick meeting once a week, or a little catch up every morning, 5 or 10 minutes, or every afternoon on what's going on, just to keep those lines of communication open. So important that everybody knows what's going on, both on the operational side and the clinical side, so that they can partner and work together.
Yeah, and I, would kind of always say, if you don't plan for something in a home care office, or you don't schedule something in a home care office, it's not going to happen. So, as silly as it seems, setting aside, actually putting in your calendar 10 minutes to catch up, wrap up, and the other thing that having that structure does is it provides it just provides an outlook for your staff. So one of the things that I would do was, for all of my staff members, once every other week on, I think it was Thursdays, I would set aside, 30 minutes for them to come in my office and basically just rant about anything that they were frustrated with, how things were going. Hopefully, maybe some things were going great. But what it did was it allowed them to kind of know, hey, I have this opportunity, I have this set time to have some of these conversations, and it really cut down on the amount of time kind of interspersed throughout the week, where I would have to deal with these kind of one-off issues here and there. They knew, okay, I have this opportunity to talk to Brian at this time, and I know I'll be able to talk through kind of what's going on. And then, constant communication, an indicator of success for me in any of the offices that I went in or that I visited was always just the conversations that were happening, and the offices that were doing really well. There was this constant give and take of information. As soon as a clinician would maybe be coming back from a supervisory visit, the recruiters would go over, or the schedulers would go over and ask, hey, how'd it go? And, the clinical supervisor would be giving updates on, anything that the client needed, or maybe the performance of a caregiver and how they were doing out there. That was always a really good indicator to me of kind of the health of the office. And then the last point that we have, it just kind of goes back to that, separate focus but shared vision. So focusing on common goals in the office, and really trying to keep the big vision in focus. So day to day in a home care office, there's so many things going on. There's so many issues that, so many fires popping up that we're scrambling to get put out, that just taking some time every now and then to remember, like, hey, we're all working towards the same thing. We're all working to try to take care of these clients the best we can be a really, powerful thing to do.
Absolutely. And one of the ways that I used to do that is to have in a staff meeting, occasionally we would talk about a success story, a big win, someone that maybe a client that we had taken care of. And for, let's say, some of our pediatric clients, we would get pediatrics who were preemies and were on a ventilator, and they might have been on the ventilator for a couple of years, and then we ended up helping them kind of wean off the ventilator, and then they just had a trach for another year or two and ended up being able to get that out, and then they started eating by mouth and no longer needed their G-tube, and basically they no longer needed private duty nursing anymore. And we would celebrate those accomplishments, and that's for everybody. That's for the clinical team, the clinicians that are right there, and caregivers that are right there in the home, all the way to the clinical supervisors and the account managers and the scheduling team who scheduled out all those visits for them. You know, everybody plays a role in that, and so we should all remember that that is the big vision and keep it in focus, and celebrate some of those success stories. You could even put some success stories in a newsletter for your caregivers in the field, so that they also are just aware that there is a big vision, a common goal that the whole agency is working toward. We're all a big team focusing on this big vision. So that is really what we have for y'all today. Anything else you had to say, Brian?
Nope, that's it. Thanks, Lisa.
All right. Thank you, Lisa. Thank you, Brian, as well, for sharing your wisdom and your insights with us today. As a reminder, we will provide everyone who registered for the webinar with a link to the slides as well as the video. So we are out of time. So if you ask a question, we will get to that via email with you later on. We'll follow up with the responses to your questions. Thank you so much for joining us today as we deliver on our mission to empower healthcare organizations and professionals with the world's best technology solutions. Have a fantastic day.
Thank you for joining our on-demand training today. Axxess is the only home healthcare technology company approved by the American Nurses Credentialing Center to offer continuing education credits and the most recommended home health software on Software Advice. You can watch more on-demand training videos through our industry-leading help center or at axxess.com, where you'll find tutorials, blogs, white papers, and answers to frequently asked questions. Axxess, empowering care anytime, anywhere.